that I am introduce to you our speaker tonight, Laura McWilliams. Laura is a CCC-SLP Board Certified Specialist in swallowing and swallowing disorders. She is an acute care leader with experience growing and developing outpatient and acute care teams. She offers coaching and consulting services focused on theoretical and practical application of change management principles curated for allied health professionals. She's passionate about change environment, team dynamics, and workplace culture. She has a deep appreciation for innovation, elevating others, and finding courage in our daily practice. Laura, thank you so much for being here. Our team at PATCOM has deeply valued your collaboration, and we're so honored to have you.
Thank you for having me on. I'm excited to be here. So I'm going to share my screen and get started. So while I get this set up, I want to first start by saying that this is a very broad topic and has a lot of components to it. So treat today just like you are learning the concepts of leadership, team culture, and innovation and how they intersect in very broad and general terms. But please feel free to put questions, comments in the chat, and we will talk through them at the end, or we can connect afterwards and continue the conversation. So if you walk away with anything today, I want you to walk away setting the intention that you can be many things at once. And this is a basic concept in leadership, culture development, and innovation that really I keep coming back to and keep encouraging people in our field in allied health to just keep in the forefront as they are on their professional journey. So my financial disclosures, I do receive a salary from my primary employer. I do receive financial compensation for independent consulting. I serve in a few non-financial commitments listed here, and opinions and statements are not representative of my primary employer and are of my own. So we're going to be working through leadership culture in the intersection of how these two concepts support a culture of innovation. So what is leadership in healthcare? Leadership in general is a very broad term, and when you try to overlay it on what it is in healthcare, there's a few definitions that we keep coming back to. It's often defined as the ability to manage a team and group effectively, influencing and motivating medical professionals to contribute to the success and effectiveness of medicine and patient care and healthcare practices. You can be very broad, you can be very specific, but really we haven't just narrowed down what exactly is leadership in healthcare. And I love this last one because it really just sums it up how broad and poorly defined it is. Healthcare leadership ideally should be guiding healthcare in the direction that we feel it should go in the future. So we are healthcare leadership by just being part of healthcare. And is being in healthcare a leader in healthcare the same as being a healthcare leader? Yes. We don't need a defined title to say you are a leader in healthcare or you are a healthcare leader. No matter where you are and where you sit in your organization, you are guiding and developing something. So that is also the intention I'd like to set today, that we need to start welcoming ourselves into the concept of leadership from wherever we sit. There are defined titles in the business hierarchy of healthcare industries, and that's more to support the ecosystem of communication, financial discussions, supply chain, how to get resources, and how to get information quickly and disseminate information quickly. But that doesn't mean that just because you aren't the VP of an arm of healthcare that you should not consider yourself a leader. Oftentimes healthcare leaders are defined as positions that are enmeshed in the business practices, and as a clinical leader, we need to make sure that we are mindful of the business practices that drive the clinical innovation that we are connected to. So we can be aligned with two things at once. We can be clinical professionals advancing what we are passionate about while also being mindful that there is a business connection and making sure that we are leveraging our business leaders to learn from them, and grow with them. So we are all leaders. And I talk about this GIF, this meme, I'm not even sure what it's called at this point, where it's three Spider-Men pointing at each other, and they're saying, who's gonna do what, right? Are you gonna do it? Am I gonna do it? Well, if we all sit around and we do nothing, nothing's going to change. So I started a deep dive into what is healthcare leadership, and I'm very passionate about the concept of competencies and making sure that we have a solid benchmark understanding of what the skills we need to have to do the things we're passionate about doing. So speech pathology competencies, occupational therapy competencies, they're the framework of where to start. And just like the definition of leadership being poorly defined, the skills and competencies that individuals need in healthcare are really something that they're just starting to define. This is literature from 2017 and developing a framework to define leadership in healthcare for competencies. And so we need to set an intention that we are all leaders as part of the healthcare system. So in this article, they broke down leadership is really comprised of 6 parts. If you are an emerging healthcare leader, it combines integrity, critical thinking, selfless service, emotional intelligence, teamwork, and an understanding of the systems that you work within and work around you. Ideally, you have a balanced 6-part piece of the pie like you see here. That's usually not typical. We're not balanced individuals. Humans are flawed. And one of the biggest things that we need to do as professionals in healthcare is know what our strengths are, what our weaknesses are, where I can find compensation for my weaknesses, and how I can share my strengths where I am. That is the basis of healthcare leadership, having an awareness of who you are, how you show up, who around you has strengths and weaknesses, and where we can align our goals to push forward. So PATCOM will be providing at the end of this a quick assessment for leadership preparedness. If you're asking yourself, am I ready for leadership? This is a good quick assessment based off of this literature to run through. The activity is a quick yes/no questionnaire. Do I have this aspect? Do I feel I'm strong in this aspect or not? And it's broken down into integrity, critical thinking, and the 6 aspects here. Then the other column is to think about your leader, or who you consider your manager, your boss, who you report to, your one-up, and start thinking about the profiles of leaders around you. How would you scale them? How would you rate them? And an understanding of how they show up as a competent healthcare leader will help you start to understand how to navigate their strengths and weaknesses and where to reach outside of their leadership. And then I challenge you to print a second copy and give it to a colleague. Ask them to rate you. What do they see in you? And then what do they see in the same leader, the same manager, the same boss? Because we have to have a working understanding of how we show up in this world, and also what we are interpreting with the leaders around us to help be more collaborative and interdisciplinary and grow together. So this model shifts and shapes as we take on different challenges in healthcare. And here's just 2 examples of how we may fluctuate depending on how we show up in different challenges. You might be in a season on your team where your healthcare leader or you as a person is really pushing into your emotional intelligence skills, your teamwork, providing selfless service, and less work outside of your team. So like that top right model or top left model. I think of this bottom right model more like a leader during the COVID panic, early COVID times, because they have really had to be savvy with their systems and critical thinking, and leaders during that time could not attend to emotional intelligence, teamwork building. They were in crisis mode. So we have to have the ability to fluctuate around this circle to support what is being asked of us and also what we need from our teams around us. I also ask each person to take a look at your business structure. Are you in a hierarchy? And what does that mean? How hierarchical is your system? If you go and speak with your boss, and then you need to speak with your boss's boss about something that you may not get the answer to. Is that good? Is that bad? If you jump into a different corner of your business hierarchy, how does that feel? Is that supported? Is that helpful? Is that good? And just understanding where you sit in the hierarchy can help you understand the ecosystem of your business. I'm giving this model as well because networked leadership is a really amazing model of collaboration and professional team development that is very contrasting to the hierarchical structure that is often what you find in healthcare. I think understanding the contrasting model helps you understand weaknesses of the hierarchy, benefits of the network, and also limitations. You find this in larger tech companies, the Googles, the Amazons, where everybody is kind of stripped of their title and they're more collaborative. They have open platforms of communication. There is no gatekeeping of information. Everybody has all shared knowledge. And that's really where there's strong evidence of innovation occurring. So we have to make sure that we understand leadership and understand allied health and where we fit, that we are being welcomed into a long history of medicine. And I'm not going to quantify, I'm not going to put specific dates on how old medicine is, because there's different eras of it in ancient times, but it's old, right? And we are being welcomed into medical practice as allied health professionals. And then nursing became more robust and defined in the early 1800s. And then allied health started to develop later than that. And then rehab professionals, and then patient safety culture, and then human factors engineering. We are really partnered with a more current and innovative arm of medical and nursing practice, and we're being welcomed into an old institution. So keeping that in the forefront of your mind helps you have those conversations to navigate with stakeholders. We are being welcomed in. We are part of the interdisciplinary team, but we're also being welcomed into an older system that has well-established systems, practices, patient safety, and quality practices that we are just learning about. And I think it's worth noting that if we didn't pay respect to where medicine has come from, we wouldn't have the amazing swallow studies that we have today. The picture of the hand is the first X-ray ever with a high dose of radiation, and we wouldn't have gotten to the modern swallow studies if we didn't have that innovative brain whenever we first developed the first X-ray. So culture, I'm going to shift now to culture, a better understanding of culture. It is complex. And when you think about culture, you have to put in your mind, it's poorly defined, almost like leadership. And it is the basis of what goes on around here and how does it impact the people around me related to the work that I'm doing. And when you think about where you sit, so I'd like to think about us being on a team related to a company, related to a bigger community. The work that we do on our immediate day-to-day does impact the circles around us. And that is your culture and your culture web and the extended arms of your reach as a clinician, as an allied health professional. We can be two things at once, but also I tell my students, I tell different clinicians, but don't be a jellyfish. So when you're trying to figure out where you are in your culture, you have to know where you sit, how your work impacts the people around you, how you can be interconnected with other people on different teams, and how your presence and your motivation and your drive and your interests are gently impacting people around you. That's you sharing your own culture with the people that are connected to our professions. I think it's worth highlighting that our mission statements, I have APTA, AOTA, and ASHA all have layers in their own mission statements of building a community, setting practice standards, advancing science, fostering excellence. Those are all cultural statements to drive their expectations of what they believe what they want to instill in various professionals who are in allied health and rehab. So they're setting standards that these are the expectations of the culture that they are intentionally setting. Culture and strategy goes together. So another quote I love by a thought leader and an organizational psychologist is culture eats strategy for lunch. So, we can have the most perfect strategy to address and make change and how we do swallow studies and different protocols for bolus trials or different techniques with splinting in the OT world. But if you don't have a culture that's prepared to be open and discussing and to change and to invite new ideas, it doesn't matter what strategy you have, you will not get that across the finish line. So, culture is what people do whenever leadership, authority, or people in power are not looking. It's often when people say, what goes on around here? When somebody is hired and they look around and they're trying to figure out how to fit in. Those first days of working in a new place, they're defining and learning how to make it. That's your culture. Do we do things that we know we need to do for patients? That's the precipice of what the culture is in allied health. Culture is complex, poorly defined, but it's simple, basic concepts. And we can accomplish two things at once. If we work on culture and we work on strategy, they can move the needle and move things forward. So culture change. We here I want to expand our understanding of how to start talking about change. And some people use the term change management. But remember, we are leaders from wherever we are. And we don't necessarily need a manager to say, hey, things are going to change around here. You can be part of the change from wherever you are. And sometimes change looks like walking into a room with a toothbrush and inviting a clinician in and saying, we're going to do oral care with every bedside. And that's going to be our culture around here. And we're going to get excited about it. And we're going to start being the people to carry around toothbrushes in our fanny packs. And we're going to provide this service. And that's going to be the change, right? That is contagious. And that is the culture. Something as simple as I have a good idea and I welcome it in is setting the stage to welcome culture change. To succeed, leaders need to free our teams to take risks, be responsible, and to constantly learn and share knowledge and to cultivate better teamwork. Teamwork and culture change align. So listed on the side here are 4 different aspects of how to start influencing culture change. And I'm going to, this could be a seminar in and of itself, but I wanted to just get this out there in the content on the slides that these are terms that we need to be more familiar with if you want to start thinking about culture learning. Okay, so in simple terms, I had a clinician say to me, and it was an OT. So when you talk about culture, what do you mean? And I think the easiest way to put it is that a group of people who are all coming together to have the same goals in mind, the same vision. And I keep coming back to getting a rocket into space, right? The people who work for NASA or Tesla or whoever, they all have one goal in mind, and that is getting the rocket into space. And if the people in engineering are committed to getting the rocket into space, they're one arm of that culture that has set that intention, and they will work hard and they will work overtime and they will do it until they get that rocket into space. But if you have this other group of engineers over here who aren't as committed, that's going to drag on when that rocket can be in space and how safe that rocket can be and how amazing that scientific advancement could be. That drag is dragging your culture and is absolutely a pocket that needs to be managed, needs to be discussed, and needs to be brought into the overall vision of where your team is going. And in this case, it's simple: rocket off the ground into space. In healthcare, it's not that simple. We have all different visions of how healthcare should look. And one invitation I invite everybody to consider is that our policies, procedures, and performance really align to shape the culture you're driving. So if you're looking for a tip to just come away from this webinar and say, what can I do to start influencing my culture and to start redefining the roles of what we do around here? Start taking a hard look at how you welcome people on your team and the policies and procedures that define what you do. And it sounds nerdy, but you keep coming back to it and back to it and back to it whenever there's different questions about safety and quality. That is the precipice, that is the start. And the policies and procedures have to define, we're going to get this rocket into space. And I expect you to support that rocket getting into space. Okay, so another on the piggyback of everybody's a leader, we hear the term change agent or agents of change. Think about everybody in your allied health community. There's patient safety professionals, educators, coordinators, onboarders, project managers, researchers, teachers, performance improvement professionals, quality improvement professionals. They have defined titles and they are agents of change. They are responsible to bringing in new information and applying it. And we as clinicians wear those hats all the time. What is in a name? You can be and accomplish two things at once. And our job should embody many of these roles throughout our work as a clinician. We're never just a clinician. We're never just an OT. We're never just a PT or a speech therapist. We are wearing one of these hats in all of the work that we do. So the intersection of leadership, culture, and how it fosters innovation. So, an innovative idea by definition sounds like a bad idea at the time. And sometimes people with really innovative ideas seem dangerous. And innovation is often created by the ideas that seem bad, but are actually really good. And in healthcare, go back to that hierarchy. In hierarchies, sometimes the good, bad ideas are squashed before it gets to the top because it looks like risk, when really it's the solution to your problems. And it just takes more investigation of what does it mean? What do you do with it? How do you push into it? So I'm going to describe a good, bad idea that actually has taken off. And I think you'll put this into better context. So who would have thought we would have developed a $1 million company off strangers coming to your house, picking you up in your car and taking you to your destination, and all by way of your phone, right? So that is Lyft, that is Uber, right? That was an innovative idea that seemed bad. I can only imagine in the 80s and 90s somebody bringing that concept in and saying, absolutely not, stranger danger, that would never happen. We'll look at that now, right? And I encourage everybody to find your Lyft. What is your next good, bad idea? And it might not be something that's as innovative as Lyft, but you might be the clinician who goes to the skilled nursing facility and says, we are going to do a pressure release protocol. And that might be innovative. That might be the first time they'd ever heard it. I always love when I find a resident or a doctor that has never seen a speech therapist scope anybody or has never seen a patient scope. To them, it's innovative, right? Capture that moment. And that's a moment of change. So let's normalize innovation. You are the first point of education. You may be the first person to show them the new science. You may be the first person to show them something that's absolutely basic. And all these things, we have penicillin, we have smart notes, we have blue dye that's packaged into single use, which I'm super excited about. The concept of open notes, storybooks to help with therapeutic practices. We have Susan Langmore with probably the first of these ever here, right? Can you imagine being her and proposing that idea of, we're going to put a camera up somebody's nose and we're going to watch them swallow? That's a good, bad idea. And look at us now. It's changed our field. So culture of innovation. It really, I love this word and I also struggle with it because it's kind of almost got too sexy. It's really a culture of finding a way to get something done, finding a way to reduce care burden, to reduce pain, to improve comfort, to improve understanding of what to do with a patient, to make it easier to fail or easier to succeed and harder to fail. And your idea can make your small idea or your good bad idea could be the thing that makes insurmountable change to change all of our fields when it comes to allied health professionals. And I put a toothbrush there because sometimes that's the most innovative idea. So I'm going to finish today with something that it's a visual that I keep coming back to, and I think it's really relevant in the project management world. It's called the Stacy Matrix, and the link is here, and we will be sending it out, or PATCOM will be sending it out, that it is strategy in the face of complexity. You have to know where your good bad idea or your idea or your project sits in this matrix to be able to understand how your audience is receiving it, and it helps you with communication. So innovation sits in this messy middle, and what you may perceive as best practice, what you may perceive as simple and rational, may sit in this middle, but you see how close that is to the edge of chaos or anarchy, right? And I like to think about standardization of swallow studies and esophageal visualization and securing scope endoscopy equipment. Some of those concepts may be flirting with the edge of chaos if you're not careful and cautious and you're not learning the ecosystem around you to help support what we know about this good practice change or this common sense practice change, right? So your goal is to always bring those innovative ideas back down to the simple best practice place to make it seem like this is just common sense. And that is how you get innovation across the finish line. So at the end, I think I'm coming up on my time here. We're all leaders. We can be many things at once. Take that with you, put it on a sign on your desk, put it on your locker, put it wherever. We have to start believing that is something that we show up in every day as allied health professionals and agents of change or change agents. It doesn't matter. We are that every day as well. So thank you, PATCOM. I hope there was something for everybody. I don't think I talked about the other cultural assessment. I think I forgot to mention that. So that's also a handout that PATCOM will be sending out that is developed by the HR Society of American HR Association to help you with better understanding your workplace culture from the HR perspective and organizational psychology. It's a really good tool just to figure out where you are. And thank you for having me.
Laura, we can't thank you enough. I tell you all the time, but every time we talk to you, it's like I just continually just get my mind blown by all of the perspectives that you have. Our field really, really needs it. We're going to open it up. If you guys have any questions, please feel free to unmute yourself and ask. But I have a question right off the bat. I loved what you said about don't sleep on history for medicine. And we've kind of chatted about this before, but how do you suggest we bridge that gap with the interdisciplinary team? Like if an SLP team really wants to start bridging the gap with the doctors, with the nurse leaders, what's like one good step that we can take in bridging that gap?
So I think it's first understanding what is the web of support. Is there already a professional in the nursing medical world whose job is understanding what happens around here and what nurses and doctors might need to know? And that's often an educator, or that's a quality improvement specialist, or that's a patient safety officer, or that's an infection prevention professional. And that, I think of the arms of the hierarchy, that arm is here to support the ecosystem of the hospital and how to deliver care to the patients. And they really serve in a unique place to help doctors, because not all doctors are created equal, not all nurses are created equal, to help them with understanding the practice changes that we're bringing to the forefront and how to implement them in a meaningful, purposeful way that is efficient for healthcare delivery, because everything is based off of efficient quality care.
Yeah, absolutely. That's really good. Anybody else have other questions?
I have a question. So in your opinion, what are the most effective ways to influence, in a positive way, influence others to become those leaders? You know, you say everyone can be a leader, but how do you, whether or not you're a leader in your role by definition or because of hierarchy or whatever, but what are your favorite and most effective ways to get people to become those leaders that you think they should be?
I love that question, and I think about it a lot because I am, by the nature of my job, a leader over a team of individuals, and I'm always surprised at what people ask me for permission to do. And I think that's when I want to hold a mirror back and say, this you don't need to ask me for this. You know, we need to talk about your PTO, but when you'll be here in your schedule and the culture of participating, but you don't necessarily need me to show your excellence and to show your brilliance. You know, you already have that in you. You need to get it out of you. I can help you with your time management of that. And I think that everybody should stop and ask, is what I'm about to ask permission for really relevant to the person I'm asking it to? And how awesome would it be if you just can just start doing? And the more clinicians I see who do that and set that intention, sometimes that idea of leadership and our one up and our boss kind of gets in our way.
Thank you. Yeah. What about the idea of role models? So you are a leader and you want to be a role model. How important do you think that is?
I think it's first accepting that you can learn from everybody and there's a lesson to be learned from everybody, and choosing your role models not necessarily in the comfort zone, but sometimes it's somebody that's not like you at all or can give you very different feedback or sits in a very different position. I think it would be really amazing to find a mentor in the healthcare financial sector to help me better understand different care practices and what we bring to the table. I also think it would be really interesting to seek mentorship outside of the field, because the allied health field, because you know, cross training is real, and what we learn outside of healthcare often is the change we need within it. And there's a really amazing, I get no royalties from this, but there's a really amazing book called Range that actually talks about this principle and how you should be cross-training, and how really specializing on one specific thing actually is only successful in certain skills, sports, talents, and not necessarily applicable for the majority of professional development or development itself. So cross-training, getting your brain cross-training. I probably need to learn to code. I probably need a mentor to help me understand that, to get some things across the finish line. And I think just not closing yourself to people who could be an ally in your learning, and not getting bogged down by the term mentor itself, because it seems so formal. You know, I'm just gonna lend this person's ear and have them teach me how to use this spreadsheet or teach me how to do a little light coding. Let's not let that.
I have another question, but you could go.
Okay, it's very different from what we talked about now, but I am curious specifically now, you know, in your hospital settings, allied health professional and everything, how big is the challenge of different generation in that field specifically? So you know how, you know, every generation X and Y and Z and whatever they're called, there's stereotypes around them, and you know what they value, what's important to them, the way that they approach work and all of that. And you know, it's one way in like in a I don't know, let's say 9 to 5 job where you go into a business and it's sort of like that type of industry. But now you're in a hospital, and you know the type of work is in some ways predefined, but how big is that challenge to make it work across these generations in the hospital?
I think that it all comes back to making sure that we're not putting people in boxes while we're still trying to understand them. And I'm a millennial, so I've gotten some riffraff in my career. And it's often when I hear things like, well, you're not the typical millennial, that I realize there's actually no weight in that scenario to that concept. And I think it's leaders and groups have to start setting intentions of, we aren't going to let that define the conversation. And really the focus needs to not be on the generational differences of care practice and everybody's journey to get there, but rather just being ready to talk about the what, being ready to talk about the what's on the table. And I think I love this question because my actual first mentor was the strongest speech pathologist I've ever met. And she was 67 years old and about to retire. And she was the person who told me, you need to take MBS-INP. You need to have a standardized approach to swallow studies. You have a responsibility to do X, Y, and Z. And I believe if she was still practicing, she probably would want to be one of the most current speech pathologists I've ever met. So I think we give a narrative to the generational differences that doesn't necessarily hold as much water if we just start focusing on the work. And focusing on the work excuses some of those barriers.
Yeah, I like it. Thank you.
I know we're a little bit over time, so if anybody needs to hop off, that's totally fine. We will be sending you those course evaluations and the certificate and some of the resources that Laura has. Laura, we want to be very respectful of your time too. But if anybody has any last minute questions, please feel free to unmute yourself or put them in the chat. I do have one last question as well. So you talked about like being able to be multiple things. What have you seen like SLPs that are trying to wear too many hats? So I feel like sometimes as an SLP, we're very type A, we want to do all of the things, and maybe we're not doing some of the things very well. So how would you encourage SLPs that are just trying to do too much and they feel like overwhelmed?
Yeah, so I think also there's an interesting pattern that happens with professionals where they have like two lives. Like they have this work at work and then they have this outside work, and they feel like they can't bring their outside work in. And then when you discover they have all of this brilliance outside of work, that my question is, why not bring some of that inward? Because healthcare needs that. They need that, and your patients need that. I work in Appalachia, right? And I think that there are a lot of patients who will never get to certain types of treatment therapy approaches simply because they need the people in the institutions bringing that excellence inside, right? So and there's a level of fear. Do I talk about the strength? Do I talk about this interest and that barrier of whatever it is of not bringing it into your workplace or your culture that's driving that not safe place to bring it in? That's really what needs to start shifting. And it's not just management that drives it. It comes from within, right? It comes within the group and the team. But today we are going to start talking about how do we bring that excellence into our work every day. I hope that answers your question. I think there is a hand.
Yeah. Jen, I see you have your hand raised.
Hi. Thank you so much for hosting this. And Laura, I so appreciate your perspectives on this. And I feel that you gave a lot of very tangible information. And I've attended a lot of leadership webinars. I'm in ASHA's leadership development program, healthcare cohort. If they could come up with a shorter name, that'd be great. And a lot of times discussions about leadership are extremely lofty. So I really, really appreciate a realistic but optimistic take on things and understanding the role of culture. I've met so many clinicians who have tried so hard to advocate for fees in their workplace, and they're like, well, what am I doing wrong? What am I doing wrong? It's like, it might not be you. I mean, maybe here's some things, try these things first, but there are places where the culture really is going to hold a wonderful clinician back. My question though is, well, I've worked really hard to try and put myself in places that don't have that type of culture. So I feel finally I'm in a job role that, supports it. I'm doing mobile fees. I'm starting a PhD in a very education oriented campus with access to clinical simulation. I'm hoping to do my dissertation using endoscopy and clinical simulation for IPE with med students and speech. So that's the big dream that I'm cooking up in my first semester. And my question, getting to it, this big dream involves a lot of players. There's hospital administration that's going to need to be involved, that I have a superficial but positive relationship with as an outside vendor. There's campus relationships that may have to be navigated amongst the different departments. And I'm a clinician. I'm a clinician and PhD student and graduate assistant. I cut up bagels for people. So entering those conversations with people with a different background and trying to make big things happen, advocate for funding, advocate for conversations and dialogue across departments, for research purposes. If you have any insight to that, I would greatly appreciate it.
Yeah, so I in the patient safety and quality sector, which is for everybody, patient safety is for everybody, quality is for everybody, so I even hesitate to call it that. But there is an approach to this that is, I guess, pioneered by University of Michigan. It's called a learning health system. And what you're describing is basically like an ecosystem of quality improvement at multiple levels. And how do you get this learning cycle going? And they have a lot of open white papers about it, how you can start working towards it, how to structure it to be successful, because there's so many parts and pieces. And it's basically taking a learning cycle and turning it like a tornado and getting everything circling all at once. And then you have a culture of continuous quality improvement, where it's doing the work itself, and you're collecting data in itself, and then it's scaling itself. So I would start looking into that literature and that work, because it sounds like it would really be impactful to help you be successful.
Thank you so much. I wrote it down. I'm absolutely going to look at it after. Thank you.
Yeah, open white papers. It's great work.
Awesome. Thank you so much.
All right, well, thank you, Laura, so much again. I love what you say. We have to keep the conversation going. So if we're going to change and impact culture, team leadership, and innovation, we have to keep talking about it. And we're really grateful for you kind of leading this initiative. I know you got your time on this topic. I know I took a lot away from it. Any last nuggets you want to share with us?
Yeah, I to keep the conversation going. So I'm happy to share and have the permission to share that I am partnering with ASHA to develop their first membership advisory group for patient safety and quality, and to actually bring resources to ASHA. And my goal is to really partner with our other allied health professionals, OT and PTs, to become patient safety officers. So that's just a way to further embed the change initiatives into the existing ecosystem of the institution that's old in and of itself of healthcare and medicine. So more to come with that, and I hope to get more information out to the world by the end of the year.
Yeah, absolutely. Keep us posted on that. We have everybody that signed up for this webinar. We'd be happy to share that information with them as that comes. And I do know that we are going to kind of roll this into a second episode of the Laura McWilliams webinar, just talking about true innovation and what you're doing now at HCA Mission Health with the PATCOM introducer, speaking of innovation. So we're going to roll this into a second episode, probably in a month or so. We're really excited about that. Any little tidbits to get us excited for that?
It's all possible, and it's putting the patient first. So get your mind right.
Absolutely. Well, thank you for your time. Thank you for everybody that joined. Please be looking at your email for the course evaluation and certificate coming your way.
Thank you.
Thanks a lot. Thank you so much.
Thanks, everyone. Thank you.